Did you know that miscommunication between doctors and nurses in the healthcare setting can lead to serious consequences for patients? Okay? Stay tuned to learn how you can master the art of communication, effective communication in the medical field as a new nurse, or even if you already start working as a nurse. These are tips that can help you. First, don't be intimidated when speaking to a provider. You are a professional. You have been training for this, going to nursing school, writing all these nursing papers, going to clinicals, and you were in training, writing all those papers, learning to think critical, and now it leads to this. Congratulations on your first job as a new nurse. Okay, welcome to Ship It All Registered Nursing, where I support new grads from passing your NCLEX to coaching new or novice nurses to become graded so you persevere and lead in the field. I am your coach, Janisha Dunkley. Let's shine. So, effective communication between nurses and doctors is essential for providing the highest care, the highest quality patient care. It ensures that crucial information is shared in a timely manner, leading to better outcomes for our patients. Okay, as a new grad nurse, you might face challenges when communicating with doctors, feeling intimidated or unsure of how to approach them in the beginning. That is a common feeling, but fear not. Ship It All Registered Nurses here. As there are ways to overcome these obstacles and build strong relationships with healthcare providers. So let's dive into them. So we already know that communication is effective and part of your career, and even in life in general, is knowing how to communicate well. If you learn the art of communicating or of communication, you have learned a valuable skill. I am telling you. You have to show confidence in your speech, be kind, know your patients, know their background. My experience, I've never knocked heads with a provider before. And when I say provider, this could be a nurse practitioner, a physician assistant, a medical doctor, which is the attending. So we are dealing with people that even had the experience as a registered nurse, because a nurse practitioner was first a nurse before they become a nurse practitioner working in the hospital. And so they have the experience. They know what it's like to be busy on the floor. Not that all of them is going to care, because you want to get done what you want to get done, but it's you as a nurse that has to stand your ground, and you have to learn to prioritize. But anyway, let us continue. We're going to get in all of that. I am not saying that I've never been pressured by a provider before where I felt overwhelmed, and that is normal, especially if you have a extensive, the word is not coming, assignment. Some days coffee, some days tea, right? For example, receiving a lot of stat orders on a patient while another doctor is contacting you about another patient with something that's going on. This is where it can become overwhelming, and this is where you really need to prioritize. If you are a new nurse, please remember you will have your preceptor, so you will learn from them. You will learn how to build relationships with the provider. You are not alone. Accept the support, accept all the support that you have on the floor, on the unit that you have access to. Please use all those resources, because you're going to need them, so you don't feel overwhelmed. I have experienced that have messaged the provider, they read the message, they don't reply, patient is going into crisis. You have to take action. You cannot use this as an excuse to say, oh, I contacted the doctor, but the doctor did not respond. Remember, you are working on a license. You are a licensed nurse. You are working under a license, and this is your license that you work very hard for, and you have to protect your license along with your patient comes first. You are going to prioritize your patient when they need it. You're going to advocate for your patient, right? And give them the necessary care that they do need. So in that case, I called a code. I went with my gut feeling and I called a code, and listen, I did the right thing. Okay, so if you're trying to reach a provider, please escalate it to your charge nurse for help. If that doesn't work and the patient is declining, call a code. You have to make that call. Go with your gut feeling. Trust me, it's never wrong. Your gut feeling is never wrong. Okay, clear and concise communication is a key in preventing medical errors and ensuring your patient is safe, or your patient's safety, by effectively conveying information to doctors. You play a vital role. You have to know that as a nurse, you play a vital role in contributing positively to that team and also to your patient and your patient outcomes. You know, most hospitals use Epic. I really love Epic because of the features that it has. You know, you're able to message a pharmacy if you need to, and you message them under the same patient that you want to talk to them about, so you don't have to be putting in the patient information, because once they receive the message, they see what patient you're messaging them about. The medical records, their name, birthday, everything is already there. Also, it's the same thing with the providers. They see who you're messaging them about, the unit, so you don't have to like say, oh, I'm calling you about this and that patient because I'm calling you about patient A, birthday such and such, because once you message them in Epic under that patient's name, they already see that information. So I really love that features that Epic has to offer, and the providers and nurses can communicate effectively that way through messaging. If, for example, your patient blood pressure is elevated, don't just communicate that to the provider, oh, my patient blood pressure is elevated. It doesn't show that you're a very competent nurse at that time. You need to make sure you give them the numbers, right? They want to see the numbers at that very moment, along with the complete vital signs. Especially doctors love to hear blood pressure and heart rate together. You cannot give a doctor a blood pressure and don't give them the heart rate. Okay, if you call the doctor, if you call the provider and you're not prepared, then this is where the doctor may get annoyed. So have all the information ready before you call. Give the patient name, the unit, the room number, vital signs. For example, this we're still talking about the blood pressure, so the last time they took your blood pressure medication and the medication that you gave along with the dosage, right? So then you have given them all this information so you can feel confident, right? And trust me, because you are prepared to answer the questions, you won't feel intimidated, because that's the problem with new nurses. They get intimidated and like flustered because they're like, oh, I'm talking to a doctor, you know. And if you are asked a question which you don't know the answers to, because none of us are superwoman or superman, you know, sometimes you may not always know the answer. Be polite about it. Ask the physician to hold just a moment and you can look, right? So remember, you are speaking with a co-worker. Providers or your co-worker. You are collaborating on the same team, and the expectation is providing the patient with quality care, right? Quality care. So don't feel pressured. We are on the same team, and we are all here for the patient, to advocate and to take care of our patients to the best of our ability. And that's the same thing why the doctors are in the hospitals, why all the providers are there. They're there to take care of their patients. So it's one team, you're working together. This is a human being just like yourself, and you should have no fear. All right, just practice effective communication. Be clear and concise when communicating, and we know that communication is the key in preventing medical errors and ensuring that the patient's safety, right? So by effective communication, we're going to give the best care ever, and the information is going to be given to the doctors or the providers the way it should, right? So the patient is going to have good outcome, right? Another thing, remember, doctors don't just have one patient, and so they may have the same feeling of being tired, overwhelmed, overworked, working all those long hours. And we know they work a lot of long hours, right? Sometimes they're at the hospitals for days, they're on call, they may be in their bed and you call them if you were at night shift. So just, be mindful of that. Next, when a doctor delegates a task to you, not because the doctor told you or the provider told you to go do it, doesn't mean you have to do it right now. You have to prioritize your work. For example, yesterday during breakfast, right? That was around like 8 a.m. in the morning, 8:30, between 8 to 8:30. A provider messaged me about urine cultures for patient A. The provider told me that patient A urine cultures were not collected during the night shift. Can you please do so now? I replied, okay, sure. However, breakfast trays are now on the floor. I have patient B, blood glucose was 294, and patient B needs to get insulin before starting to eat, right? We know this is a fast-acting medication and we should give it at least 15 minutes before the patient eats. What would you do first? In that instant, you are going to prioritize, right? Along with delegating the task so it can be done fast. Correct? Ask your PCT or your PCA or your nursing assistant. Check if the patient has a cap in the bathroom. So in case the patient is going to urinate in the toilet, you can get to collect it, right? So you're delegating at that time. So you're doing what you're supposed to do. You're prioritizing, but at the same time you're delegating so we can start putting that in effect, right? If the patient is self-care, for example, this patient is alert, they're urgent times 3 to 4, the patient ambulates to the bathroom, you can also tell the PCA to give the patient the cup and have the sterile cup and have them urinate in it if for example they go to the bathroom before you get to that patient. So these are ways that you can delegate those tasks, that not because the doctor delegated to you, that doesn't mean that you're gonna stop what you're doing, which is more important, and go and collect the urine specimen. You can also delegate that. So learning to communicate as a new nurse and delegating tasks are ways that you can make it better. So for example, you're going to delegate, right? These are the roles that you need to master in your field. It is communicating, delegating tasks, because things are going to be done timely so you don't feel burnt out and you don't feel overworked. Treat your providers with respect and expect the same. I know you may experience rude, obnoxious behaviors. Like, that's going to happen even with other nurses on the floor. It doesn't mean it's going to be just the provider that's going to be like that. You're learning to communicate even with your co-workers and nurses. Everyone is coming from different backgrounds. you're dealing with the pharmacist, you're dealing with the pharmacist, you are dealing with the nursing assistants on the floor, the housekeepers, you know, so many people that you have to deal with at work that come from all different backgrounds. They have all different sexualities, all different religion. Like, but listen, you're there to take care of your patient and to do it to the best of your ability. So learning how to communicate, learning not to bump heads with people, that will be best for you. So you're going to deal with obnoxious behaviors during your career, but that don't mean you're going to argue. That doesn't mean that you're going to go back and forth with anyone. You're going to stay professional, classy, you know. It is something you can avoid. You avoid it. Whatever confrontation that you can avoid it. You're there to take care of your patients. Okay? If it's a situation where you need to report it, then you report it. You know, I'm not saying that you're gonna, you know, let anyone walk all over you. If it's something that you have to report, then report it. Okay? Another thing, if a doctor tells you to do something, please get your orders first. Ask them to place a order. You have to know what needs a order. And if you don't know, then you speak to your charge nurse. If you're still in the preceptor season, then you will, you know, go ahead to your preceptor. If your preceptor doesn't have the answer, then you move up, right? So the simplest thing as a bladder scan, it needs a order. So oxygen, it needs a order, especially if it's more than 2 liters. You need a order. You need them to put an order in. If it's going to be PRN where the patient use it as needed, you need a order. Get your orders from the doctors. Okay. You are a new nurse, so ask questions. Don't be afraid to ask questions. If the doctor instructed you to do a task, find out if an order is needed. Please, 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 please. All right. So, in summary, with everything that we have spoke about, mastering the art of communication with doctors involves active listening, assertiveness, and clear communication. These are strategies that can greatly impact patient care and enhance the collaboration with the healthcare team and with all the providers on the team, right? So share your experience with your communicating with doctors in the comments below. I would love to hear them. Don't forget to subscribe to my channel for more nursing tips and advice, right? We are all one team, and this video was done because one of my subscribers asked me to do it, but it took a while because I lost my sister, so I was off for like 2 months. So I'm back, and I did this video, and I hope you enjoy it and you learned something. So Triple Registered Nursing, my name is Janisha Duncan. For those who are here for the first time and you watch to the end, remember to like, subscribe, share the video. I will see you soon. Let's shine.